Howdy everyone, this is the pharmacology discussion post. The question was, discuss the difference in managing a postictal patient and the status epilepticus patient. So I'm just going to kind of start off with that status epilepticus. For someone in that state, we know they've been having a seizure for either more than 5 minutes, or they're continually having seizures without coming out of that postictal state. Or sorry, not even entering the postictal state. So in these scenarios, I really don't want to waste a whole lot of time on scene. Obviously, we want to try and stop the seizure, give an anticonvulsant, intranasally, intramuscularly, to try and stop that seizure. And if it is stopped, then great. We get better vitals, get an IV so that we can try to start another one and run hot to the hospital. If not, if they don't come out of that seizure, just passive O2 and running hot to the hospital, try and get an IV and stuff if that's even possible, depending on that patient. Your postictal patients are going to be a lot different. We're going to want to get initial vitals on them, obviously. Get them on some capnography, give them a little bit of O2, especially if they got some room for it, kind of help them come around and out of that postictal state. And then it kind of depends on what the patient wants. I personally like to sit around a little bit on scene just to see, like to sit around on scene if they have a history of seizures. Just because I like to try and wait a little bit and give them the chance to say if they want to go to the hospital or not. Because a lot of people who have a history of seizures would rather not go to the hospital and would rather call their neurologist or primary care or whatever instead. So I do like to give them the option if they do have that. Obviously, I would advise them to go to the hospital, but I believe they should have that, especially if they have a history of it, have that right to refuse. But either way, let their neurologist know and to go and get everything looked at, no matter which decision they make. If they don't have a history of seizures, I'm going to go ahead and say that it's in the patient's best interest, to go to the hospital and start transport then, because obviously if they don't have a history of seizures, something else is going on. So yeah, that's it. Thank you.